So you may be having a stomach ache and wondering, oh man, do I need to go see a doctor about this? Well, in this video today, I'll give you 5 reasons why you're having the stomach ache, 6 things that I look for as a doctor to make sure nothing bad is going on. If you wait to the very end of the video, I'll give you my number 1 tip if you have some of these warning signs. Coming up next. A lot of people have stomach pain. Ooh, belly pain, oh, it hurts. And a lot of people have this, and for the vast majority of people, it is not that big of a deal. But there are certain conditions or certain things that we look for as a doctor that lets me know, hey, something else is going on. These are called warning signs. And once I hear these warning signs, this makes me wonder, is something else going on, and do we need to do further investigation? But why are you having stomach pain? One reason is stress. Stress plays a significant role inside your gut. There is a connection for sure between your brain and your GI tract. The more stress that you have, the more it can have an effect on your gut, whether it's diarrhea, constipation, pain, or ulcers. So stress is a common reason to have belly pain. Reason number 2 are actual ulcers. We can develop ulcers inside our stomach that can present as really, really bad pain. And there are a lot of different reasons why you can have an ulcer. Stress, like I mentioned before, taking certain medications like ibuprofen or non-steroidal anti-inflammatory drugs, sometimes even alcohol or medications or even infections can cause ulcers to form as well. You also may have a problem with emptying your stomach called gastroparesis. This is a condition in which your stomach doesn't empty appropriately, and so food just stays in your stomach to cause nausea and pain to occur. You may also have another condition called functional dyspepsia. It's a very fancy term, but basically it's IBS of the stomach. This is when your stomach becomes super hypersensitive to anything going on inside. The best analogy I have is like having the radio on but the volume turned way up. Your nerves are super sensitive, they're super high, and that can cause symptoms of pain to occur. And then lastly, there are other medications that can cause stomach pain. A lot of medications that people take, whether it's pain medication, blood pressure medication, medication for depression, have a side effect of causing GI issues, and that may be a reason why you're having stomach pain. But there are 6 signs that I look for that when I hear this from my patients, this tells me something else is going on, and this is not just the ordinary stomach pain. And if you have these signs, you need to make sure you speak to your doctor about this. Number 1, if you have bleeding of any kind, whether it's black stools, red stools, or your blood count is no, that is never a normal thing to have when you have stomach pain. Having black stools could be a sign of a bleeding ulcer, and that needs to be investigated immediately. You may not have black stools, but your blood count may be low, or you may be anemic. That is a low blood count. That also may be a sign of something bleeding inside your GI tract. And if you have that with the stomach pain, that is something that we can't ignore. Number 2, getting full quicker than normal. This is called early satiety. So this may be the occasion where you normally eat a good amount of food, but for some reason, you just can't eat enough. You just get full quicker more often than not. Food is left on the table, you just don't eat as much as you used to, and you're just not feeling like your normal self whenever you do eat. Number 3 is severe abdominal pain. This is not the occasional rumbles and grumbles you may have. This is severe pain, pain that you've never felt, pain that is new, pain that's excruciating to the point where, oh my gosh, I need to see somebody about this. That is not normal. That needs to be investigated. Number 4, if you have a new onset of symptoms over the age of 60 years old. So if you have new stomach issue and you're over 60, this is considered a warning sign. Now, if you're younger, in your 20s, early 30s, if you have stomach issues, there's a good chance we may put you on some medications, maybe change your diet. But if I have somebody who's over the age of 60 who comes to see me, who says, oh, Dr. Islam, my gut hurts, that is not normal, and I need to find out exactly why, because that is something I need to make sure that we don't ignore. So age is a very important factor for us to know if something bad is going on or if it's just nothing to worry about. Number 5, if you tell me you have a family history of stomach cancer, bing, 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 that is something I will not ignore. Stomach cancer is a very difficult disease for us to catch, and also a very difficult disease for us to treat if we find somebody who has that. And there are some conditions that can be passed on from one generation to another. So if I hear that you have somebody close to you who's had a history of stomach cancer and you're having stomach pain, I am not going to ignore that. I need to find out exactly what is going on and what we need to do to get that investigated. Number 6. If you've had a condition called H. pylori, which is a bacterial infection of the stomach that can cause a lot of gut issues, gastritis, inflammation, even ulcers, and I come to find out that it was not treated, that gives me a warning sign that something could be going on inside your stomach that we have to investigate it. Untreated H. pylori, for some people, not everyone, has the chance of going to ulcers, cancer, and lymphoma. So if I hear that you've had H. pylori in the past, it's not been treated, or you've not had it checked to see if it's been eradicated, I may do further investigation to find out exactly what's going on. So now that I've freaked you out about having these symptoms, you may be wondering, man, what do I need to do now? What do I need to ask my doctor? Well, guess what, guys? I'm here for you to answer that question. So if you have any of the 6 warning signs, which are number 1, bleeding or anemia, number 2, getting full quicker, number 3, new onset, really bad abdominal pain, number 4, new onset of symptoms after the age of 60 years old, number 5, if you have a family history of stomach cancer, and number 6, untreated H. pylori, the number 1 uno test you need to do to find out exactly what's going on, and what you need to ask for is an EGD, or an upper endoscopy. What this test is, it's where we put you to sleep, use a very small camera, take a look all the way down the mouth and the esophagus. Don't worry, you're asleep the whole time. I take a look to find out exactly why are you having your symptoms. Do you have an ulcer? Do you have that H. pylori infection? Is there a concern about cancer? Is there something else going on like a blockage? We can find out exactly what's going on and possibly do treatment for you. But these are the 6 things you need to worry about if you're having stomach issues. And if you have this, I would recommend for you to ask your doctor to schedule an upper endoscopy or an EGD. Guys, I want to thank you for watching this video. If you like this video, consider subscribing, smash that like button, follow me on all my social media pages, and don't forget to join my newsletter. But if you want more videos on what ulcers can do, click over here. Or if you want more information on what you can do to help out with your gut health, click here, guys. But everyone, stay happy and stay healthy. Guys, I want to thank you for watching this video. Don't forget to smash that like button. Guys, I want to thank you for watching this video. Can't speak. Smash that like button, and don't forget. I can't speak today, so I can't tell if am I too close. Yes. Mama's home. Mom's home. I'm talking to the camera. Hi.